Hi, good morning, all. So my name is Deepak Madala, and I'm director of the Enroll Virginia project. It's a project, as Tony mentioned, as the Virginia Poverty Law Center, and we've actually been a project of VPLC since 2013. So 2013, of course, was the launch of the Affordable Care Act in Virginia. That's when the health insurance marketplace made its debut, and that's when VPLC kind of took it upon ourselves to create the project, because I have scary memories of that year when it launched. It was both a complex, still is a very complex new law at that time, still is very complicated for a lot of people, but also the problems that existed with just the enrollment process itself. So Enroll Virginia was created as a kind of a community-based effort to just help Virginians understand the new opportunities, the new coverage options that were available, and how to access them. We tried to, since this day one, try to be non-political, just kind of being available and in person. We actually have locations throughout Virginia. We partner up with health centers, legal aid offices, of course, other community-based organizations, some free clinics throughout the state, to just kind of make it as easy as possible to people to reach us in their communities, where we know a lot of people are, still to this day remain uninsured. I mean, one of the best things about the ACA for Virginia has that, when the ACA came into effect, I think it was over about 900,000 were uninsured at that time. And we've now cut that number down by nearly, I think, 350, 400,000. That still means we still have about 500,000 still remaining uninsured. I know, Medicaid expansion and the ACA itself have really made a big dent in that number for us, but we still have a lot of work to be done. I think that's what Sara Cariano, who helps lead Enroll Virginia with me, will kind of explain some of the work we're doing today on how to address some of those barriers and how we're reaching them.
Good morning, everyone. So as Deepak said, my name is Sara Cariano. I work with Enroll Virginia as well. If you bear with me, I'm just going to share a screen quickly. So as Deepak said, I wanted to give y'all a little kind of taste of where the offices are across the state that we work with. So you can see our offices, in conjunction with our partners, really do provide statewide assistance for all of Virginia. So no matter where you are, if you know someone in your community who needs some help, please send them our way, and we can hopefully get them connected to some level of assistance to help them figure out health coverage. So again, I thought this was a little bit easier to show in chart form who the uninsured in Virginia still are. My main takeaway here is that the vast majority, 66%, are under 200% of the federal poverty line. So these are non-elderly adults. The vast majority of these folks will either qualify for Medicaid expansion or qualify for really significant subsidies through the Affordable Care Act at that below 200. The subsidies are really substantial, especially with the passage of the American Rescue Plan and the enhanced ACA subsidies that came with that. So what our job is really to dig in and figure out, okay, why are these folks still not enrolled, and how can we reach them and at least make sure they know about their options? And what we found, and what a lot of national research has found, is that there's still a really large lack of awareness about health coverage options. The systems and rules are still very complex, and so people who start the process sometimes just don't finish it because it's really complicated. Folks who don't speak English or don't have technology access, there's a lot of conversation right now about ensuring broadband for all of Virginia. Those are barriers. The actual cost, as well as the perceived cost. There's a good number of folks who think they can't afford it, and so don't even try because of what they've heard in the media or what friends have said, without really knowing what their options are. And lastly, there are some eligibility gaps in state as well as federal kind of rules that still keep some folks out of coverage. My one caveat about this slide is that it's 2019 data. That's the last kind of robust census data that we have at the moment. And it was collected throughout 2019. For those of you who remember, 2019 is the year we launched Medicaid expansion. So it doesn't grasp the full reduction in insurance that we, in the uninsured that we likely saw by the end of the year. And even this past year, our Medicaid expansion numbers have exceeded 550,000. So over 500,000 folks are insured just through that Medicaid expansion group. So that under 100, 138 number is very likely lower at this point. But this is just kind of the most recent data we have. There's always a bit of a lag. And so this is just a very recent survey that was done during the pandemic, just to call out the lack of awareness of marketplace options, and then the even larger lack of awareness of the financial assistance on the marketplace. So if you look at those last two bars, the blue, you'll see a little under 50% of folks still weren't aware of the marketplace as an option to look into, and a little under 65% didn't know of the financial assistance. So, you know, if you know it's an option and you don't know you can get help, a lot of these folks aren't even looking at this coverage as an option to see what they can get. And lastly, I just wanted to list some of the eligibility gaps that still exist. I won't go through these for time's sake, but did want to put them out there. There are still some complex rules around employer coverage, keeping people out of the ACA. We charge folks who smoke more. The American Rescue Plan subsidies that I referenced before, and I'm happy to take questions about, are currently only through the end of 2022. And so we'll see what happens after that. And then the state also has, compared to other states, lower famous CHIP eligibility levels for our children. We have lower levels for 65 and disabled individuals for Medicaid, and undocumented individuals in the state really have very limited, except really limited options. The state did in the last legislative session take on a Medicaid option where we could cover pregnant women regardless of their immigration status. We're really excited for that. We've been working really hard on trying to get the word out. That begins July 1 with the new budget, and then emergency Medicaid does cover some emergency services for individuals regardless of immigration status. And that policy is mostly to ensure that hospitals are getting reimbursed for care that they're providing. So I'll stop sharing now. And as Deepak kind of said, I do Enroll Virginia. Enroll Virginia is nonpartisan. I also do some state level advocacy work is another part of my job. And so if folks have questions about that work and in terms of help as it relates to providing options and what we're working on, I'm happy to answer those questions as well. But that's really the very high level overview of our program and the uninsured in Virginia. And we really would just love to hear kind of what y'all are thinking, what you're curious about, or what you'd like more information on.
Okay, thanks. Thank you, Deepak. Thanks, Sarah. I'd be remiss if I didn't say thank you for all the work that Deepak and Sarah, and I see Amber's on here too. All the years you've done and all the people you've helped get health insurance. We really appreciate it. This has been a great project of ours. I don't see anybody have any questions? Feel free to raise your hand or put it. I don't see anything in chat. I'll ask a question if nobody else does. Sarah or Amber or Deepak, why do you do this work?
Sure, I'll take the first stab at that. I mean, it's you know, I think many issues are kind of critical to just the clients that we work with, but I think healthcare is kind of in a special place because it's very personal to each family. It's each within the family member. It's like very individual as to kind of accessing something that they really need. And, you know, it's sometimes times of crisis, but sometimes it's just kind of like things that they've been dealing with for many, many years, kind of chronic kind of issues. And I think first with just the marketplace opening in, 2013, that we got, several 100,000 enrolled at that time. And that kind of had that first impact. And then once we had Medicaid expanded, it was just, navigators would tell me all the time, our team, that this was like the best job they've ever had in their life, because they've done many things. Sometimes they're, worked as paralegals and other things, but once they got to this job, it's just like you're able to kind of connect people for the first time in their lives to health coverage, and it just opens up so many things for them, including just financially too, right? That taking that burden off their shoulders has been just a great thing to be a part of. And usually we're able to do it. I mean, that's what's nice in Virginia now, that nearly everyone in Virginia has some access to affordable care. It's actually true now, especially with the new American Rescue Plan that just passed this year, that kind of enhanced the subsidies that were already within the ACA. Even people above 400% have access to very affordable coverage. So it's a really good thing.
And I'll just add, I think access to healthcare is, to me, kind of, it is very basic kind of equity and justice issue still in our country. If you look at who's traditionally had the most barriers or been unable to access, really basic healthcare when ill, or not go into debt when sick because they've had an emergency, it does impact our lower income communities. It impacts, communities of color. It impacts our immigrant communities the most. And I think that impacts the rest of someone's life when they have this massive debt, or they've gone bankrupt, or they're ill and can't get care and can't work. It is just a really basic equity and justice issue that I'm really grateful I get to work on. And I really love that at VPLC I get to do one-on-one help, like the client stories, like helping someone is, selfishly rewarding, but then also getting to work on these bigger picture issues where we're working to provide that access to broader groups. It's really unique to be able to see both the micro and the macro and work on both.
Okay, thanks. Delegate Simons, you have your hand up.
Good morning. Thank you so much for this really informative presentation. It's so important for our urban areas and my constituents, so I really appreciate it. So did you say that 66% of uninsured Virginians actually would qualify for some financial assistance? Was that the statistic that you gave us?
Yeah, so the numbers are from 2019, uninsured non-elderly adults, that 19 to 64 population. And 66% were under 200% of the federal poverty line. So up to 138 would likely be covered by Medicaid expansion. There are certainly some undocumented individuals who maybe wouldn't be eligible, but the vast majority would likely be covered by Medicaid expansion. And then up to 200% on the marketplace, you not only get really significant ACA subsidies, you also get what are called cost sharing reductions in a plan. And so you get help buying the plan with those premium subsidies, and then the cost sharing reductions bring down your deductibles and your out-of-pocket costs as you're going to access services. And so that's why I looked at that 200%, because you do get pretty robust assistance on both sides of the health, like the cost of health insurance, getting it and getting the care.
And where, if we have constituents that need to enroll, is there like, and if they don't have good computer online access, is there like a place where we can send people to enroll or get more information? Like where would we tell them to go?
Yeah, we can put our website in the chat, the Enroll Virginia website, where we have a map and you can find local offices. Our map is also actually embedded on the state Cover Virginia website, which is their Medicaid kind of informational website. Usually we are doing a lot of in-person assistance, where our staff right now is doing it based on their comfort level. And so some offices are doing in person, some are not. We also do phone assistance, so we can help with an application over the phone. So we have been able to work during the pandemic to try to still provide as much as high level and hands-on assistance as we were able to when we were all in person. And we're certainly working towards going back towards all in person now, and are very excited to be back there. But yes, phone, Zoom, limited in person right now, and working towards a more robust kind of in-person network again.
Okay, we have some questions in chat.
And I did just put in the chat the link to the map that we actually showed on the screen. That's the Get Help map. And so that's where you'll find all of our in-person locations, where you can also find phone numbers for local navigators throughout the state.
And
Thanks,
Billy
Deepak.
put the phone number in there. It is, if you put in your zip code, it automatically directs you to the local office. So for those folks who can't pull up the website, if they just dial into the phone number and put in their zip code, they'll get directed to the local office.
Thanks. All right, here's a question from chat. What, if any, changes will happen after July 1st? Also, what can I do to help spread the word to help uninsured understand they have access?
So all of the July 1st changes are really going to be Medicaid related because they were tied to the state budget, which goes into effect July 1st. The prenatal coverage for women, regardless of immigration status, is one of the biggest ones. And the next biggest one is the dental benefit that's been added to adult Medicaid. Virginia has for a long time covered dental for children and pregnant women, and now we're covering it for all adults in our Medicaid program, which is really huge. I mean, we've for years and years and years seen oral health as a huge barrier to overall health, and it's been something a lot of the folks we work with consistently ask about and have had a hard time accessing. So we're really excited about that. There's also a doula coverage for women in Medicaid going into effect, as well as a 12-month contraception. So a woman can get contraception for a full 12 months. So if her coverage gets disrupted, her birth control plans don't get disrupted. So that's also going into effect July 1st. And then, sorry, Jay, what was the second half of that question?
What can I do?
I think the other part of it is still, I think, one of the biggest barriers, I think this even kind of goes back to the question that Ben had, was kind of what are some of the issues? And one of the biggest issues has always been just lack of awareness. So there are some really great benefits available to people, but they just are not aware of the changes that have come about. Like they've tried, like, many people have tried applying for health insurance, even on healthcare.gov, but they've been disappointed as to what they've seen. But those two big things have changed. One was obviously Medicaid expansion, but then also the changes under the rescue plan have really significantly increased the subsidies available and the availability of very low cost options. And I think those two things people are just not aware that those are available. They've been frustrated, and so it's that piece of it, trying to get that word out. So even July 1, that's why we're kind of excited to have something like dental, because that really can help encourage people, come back and take a look again, because you may have tried before and you've been found to be in the Medicaid gap, but we don't have that anymore. We now have comprehensive Medicaid plus dental. So
and what are we doing to help get people for more people to understand what's going on?
Yeah, so first Billy put a Google Drive folder in there with all our flyers and stuff for materials. So we love partners. We work really closely with partners. At this point, a lot of the folks who are unaware, you have to go down to that next level of outreach, which is part of why all our navigators are in their communities, building those relationships. It's harder to reach people at this point than it was early on in the ACA. And so working with groups who are embedded in their community, with our health center friends, with our hospital friends, with folks in their churches and their food banks, all of those are immensely valuable to us and our work. And so if there's anyone in your community that you'd like to connect us with, please reach out. We love those partnerships. And then Billy and Amber have done such a wonderful job on our materials in the last year. With Virginia taking over the state-based exchange, our program was able to kind of build our funding back up a little bit. It had been reduced greatly under the previous federal administration. And so we've been able to build our Navigator team back up and our outreach team back up. And so we have a lot of really great materials getting out about Medicaid, dental, and prenatal coverage, and just the ACA and the new subsidies. So help us reach your communities is really my ask. And Deepak, Billy, Amber, feel free to fill in what I have forgotten.
No, that's great. Thanks, Sarah.
Okay, the next question is, are you still seeing significant delays in Medicaid application processing? Have you all started planning for when the federal emergency expires and when many people can be disenrolled from Medicaid coverage?
Yeah, so those are two different kind of questions. The State Processing Center for Medicaid is seeing delays in their Medicaid processing time right now. Under federal rules, Medicaid applications are supposed to be processed within 45 days. And because of some contractor issues, there are delays at the state level. So if you have someone that you know who's having issues or is not hearing back on time, please connect with us. We're absolutely working with people to make sure that their applications are going through, have been received, or being processed. The one thing that is helpful is that your Medicaid effective date, once your application is approved, automatically goes back to the first of the month that the individual applied. And so it's not necessarily creating a gap in coverage, although, you know, it is creating anxiety. It is much more difficult to get a bill that you've already received resubmitted. So that's by no means a solution, but it is at least a level of protection for individuals who are having to wait longer to have their applications approved. The second is a question related to, during the federal public health emergency, the federal government is giving states an extra boost in funding to their Medicaid programs. To receive that funding, we have to comply with their maintenance of effort rules, which means for the most part, we are not allowed to disenroll anyone from Medicaid. And this is part of why we've seen these really large Medicaid growth numbers, because nobody's coming off the rolls. We're not seeing the churn that we usually see. You'd see there were headlines out yesterday and today of 10 million people on Medicaid. You know, the large Medicaid numbers across the nation are as high as they've ever been. That's partly because Medicaid expansion and partly because of this maintenance of effort where we're not taking anyone off the rolls. That will end at the end of the federal public health emergency, which the Biden administration has said will likely be at the end of the year. We don't have a final date yet. We are also waiting on guidance. The states are waiting on guidance from the federal government right now on what they're calling unwinding process will be. So how long will we have to reevaluate all of our Medicaid cases? How long and what will that process look like? So we are closely keeping an eye on it and are in communication with the Department of Medical Assistance Services so that, you know, we can help with that process when it comes to that time, but we don't necessarily have all the details as to what it's going to look like quite yet.
Did I hear you say that you don't think that's likely to happen until the end of the year?
Yeah, so the Biden administration has put out a statement that says that they fully anticipate keeping the public health emergency in place until the end of the year. They're only allowed to extend it for 3 months at a time. So each 3 months it's been extended. And again, they've said to states, please know that this will happen. We will keep this in until the end of the year. It'll be a pretty massive undertaking for all states when it ends to go through all their roles and reevaluate everyone. It's going to be hefty for sure.
Mhm.
Okay, here's another question. What type of training is required to become a navigator in Virginia?
Sure. Yeah, so Virginia does actually license the navigator in the state. So it's through the Bureau of Insurance, and the state-based exchange now that just started last year also has a role in that. So the state-based exchange is the one who kind of selects us. You actually apply to become a navigator in Virginia as a navigator program. And then if you're selected for that, then, you know, the state-based exchange helps with some funding. And then you also get access to a federal training platform. So the federal government actually offers the training, and that's where navigators kind of learn, become, you know, experts on kind of the subsidies themselves and the enrollment process, but also kind of the plans available and the plan selection process and that type of stuff. And then they're certified through the Bureau of Insurance. So that's kind of the process in Virginia. And we're always, you know, we do also, in addition to the navigators, I would also add, we have a big team of what they call certified application counselors. And those can, in many cases, also be volunteers. And so we will kind of help them get trained to kind of work alongside navigators, particularly, you know, in normal years when we're able to host larger scale events. When we're going into the community, we can work with these volunteer CACs and other CACs to kind of expand our capacity to reach as many people as possible. Particularly people of language skills are really helpful to us to provide that direct assistance to communities who otherwise, you know, can't get coverage just through the phone or the thing because they're not speaking, you know, English or even Spanish in many cases.
So there's a lot of information in the chat. If you haven't already seen it, links to our website and social media sites and information to share. So take a look if you haven't already.
Yeah.
Deepak, you mentioned something you may want to expand on, that a lot of our navigators speak Spanish, right?
Mm-hmm. Yep. Absolutely. And that kind of goes to that, what we've been looking at as far as like, if we still have, say we have approximately like 500,000 uninsured still remaining in Virginia, that, our understanding is that it's disproportionately still that in some communities, if people are, particularly, I think there's also this overlap with immigration issues, that there was a well-founded fear over the last 3 years or so, 4 years, that something called public charge. It's a immigration rule that was put in place or expanded on under the previous administration that did cause a lot of fear among immigrant communities, and particularly among Latinx communities in areas, just the way the stories were written and the way the fear was there. But that's gone away now under the administration, but it's still, there's hesitancy to enroll in public programs broadly. And that's where we made a concerted effort last year to staff every single office with the legal aid programs with at least one bilingual Spanish speaking navigator to kind of help us reach more of those kind of uninsured, but likely eligible families.
We also have a Korean speaking navigator in
Yep.
Northern Virginia, and there's 2 navigator programs in Virginia, and the other one is Bless OS. They work predominantly with the Vietnamese community, and so they have Vietnamese speaking navigators as well. And on that point, I'll just add the Medicaid and marketplace rules for non-citizens are even more complicated. And so when you're working with a population where there's fear, there's maybe language barriers, and the rules are even more complicated, the one-on-one assistance is so much more important. And I'll just, because Medicaid covers fewer non-citizens, the marketplace has broader eligibility rules for them. So as long as someone has really almost any kind of status, unfortunately, as I said, there's very limited options for undocumented individuals. They can get marketplace or Medicaid if they're income eligible. It's just more challenging to figure out the process and kind of what they are eligible for. So particularly those communities, that one-on-one assistance can be even more valuable.
Okay, I don't see anybody else with their hand up or any other questions that you haven't already answered in the chat. So thanks everybody for joining us, and I hope it was informational.